the process for the patients being referred to Dr. Julian to be able to go in and book an appointment with a therapist, undertake assessments, have a look around their dashboard and understand the different options available to them, go and have the appointment. It will also include some screens showing how the therapist confirms the appointment as well. So, once a patient is referred to Dr. Julian, they can either be referred directly from NHS systems through our integration, or they are added onto the platform itself. A patient will receive an email of how to log in to the system and some instructions. If they're using a laptop, they will be able to use our web app. If they're using an iPhone or Android app, we would advise them to actually download our native iPhone and Android apps. So if they're using a phone or a tablet, they can go to the App Store to download, or the Google Play Store to download our app. I'm going to take you through the web app here, but our apps have exactly the same functionality for the patient, so they need to use the different ones. So the first thing is they need to be able to confirm their email address and set a password. So they click a link and then they need to be able to set a password. Once they've set a password, they can go to our login screen, which will take them automatically to their login screen, and they would be able to agree to our terms and conditions and our privacy notice, which they can read if they want, and click login. If they ever forget their password, they can click the forgot password button, which will send them a reset password link to the email address that's registered for them to be able to set a new password at any time. Once they click login, they will then be presented with a dashboard where you can see various screens here. They have a screen of all the assessments that they've undertaken, a screen for assessments to undertake, which we'll go through in a minute, a screen for previous appointments that they've had, and in this screen they can look back at any notes and text transcripts between the therapist and the patient. If the therapist had given them any information that they'd need or links to things, they can go back and look at that. They've got the screen of their upcoming appointments and any frequently asked questions. On the top left here, they've also got a way of accessing the various elements as well, which we can go through in a minute. And on the top right here, they've got their account details and their profile. And if they have missed certain things out, they do get prompted to fill in, make sure that they've filled in their profile correctly, including their GP name, their phone number, their address, and any change of password that and they can change their password here as well. So if they haven't given us the information such as their address, their GP details and their phone number, they'll be prompted to do that. Again, just to say that I am demonstrating this on a test patient. So once they are logged in, they can go to click book appointment here, or they could go up here and click book appointment. And then once they click book appointment, they can either be click match me please or specific therapist. If they click specific therapist, they can search for a therapist by name if they know the name of the therapist that they would like to book in with. Or if they click match me, then they will be presented with various filters. The way the platform is designed is that we will allocate therapists to specific portals that the patient will then be logged into, which means that if that patient is due to receive step 3 CBT treatment, then they will only be able to book with therapists that are appropriately qualified and accredited by BABCP to the standards that are needed for patients to book in with. So they wouldn't be able to book in with someone who wasn't that from that perspective. We can also, just to show you here, there's filters that the patient can use to be able to find a therapist that most meets their needs. So they can filter the list of available therapists via an issue that they need help with. So certain CBT therapists, for instance, might have special interests in different areas, and it might be that the person can find someone that can most meet their needs from that perspective by clicking on that list. They can also click a language, so it could be that person would prefer to have a therapist that speaks their language, in which case that would narrow the list down to those therapists that are available in that language. Again, the therapy type here, as I say, is not relevant from a CBT perspective, because it would only be the CBT if it was on a CBT portal, or accredited counsellors such as counselling for depression on that portal, and we can switch that off if needed. And they can filter the list here by appointment type, so you've got the option of video, voice or text. So we're trying to empower patients here to give them choice of the therapist that they want to book with, the time of the appointment that they want, and the medium of appointment that most suits them in discussion with their therapist. So it could be an instant message, it could be via the phone, or via an audio online, or by telephone, or it could be on a video. And then they have the choice of dates. So they could find therapists available on a specific date and use the date function to try and find that. They could click ASAP to find those therapists available within 24 hours. And if you click on a therapist, you'll see the availability that they have within 24 hours based on their calendar here. Or it could be that a therapist available in the next 7 days. Or any means any therapist that has any availability. If they unclick the any filter, it means that it will show all the therapists in the system, even those that haven't uploaded availability, and that would be therefore if someone wanted a therapist of a specific language or rare issue that they need help with, they can find that therapist of that language, for instance, and then send them a message to find a time slot that suits both of them that they can then book into. So just to show you, I've showed you briefly there before, so if they've got they've clicked the filters, they can then search the list of those therapists and they can click on a therapist and they will see that calendar of availability of that therapist, and all of these slots are slots that they can book into. They can simply do that by clicking on the slot and then clicking proceed to booking basket, and we'll show you that in a second. But what they can do to make sure that they want to find the therapist that most suits them is they can view their full profile and have a read of their biography that they've put in. And if they're not sure that that person suits them, but they quite like that person, they can send them a message first to make sure that they're the right fit. So we're really sort of giving patients the choice of a therapist and getting them to book it in themselves, to try and give that empowerment back to the patient. So, as I say, you can go through and have a look at the different therapists available at different times, and they can have a look at those profiles. Now, some people might not want to choose and they might be overwhelmed with the choice. So, as I say, we on our emails and things, we have a customer service support team on hand via email and via phone to help match people and to get them booked in when they would like, if someone is a bit overwhelmed by this. So some people as well might really struggle with technology, and in which case our admin and our customer service team can do this bit for them and actually book them in. We can book them in so the person doesn't have to access the system or use the technology. But we find that if someone's actively engaged in the technology, that's the idea of this, that we can try and get them engaged. But we have backup options if someone is struggling with technology. They can call our customer service team to help book them in. So I'm going to book in with a test therapist now. So I'm going to book an appointment slot in, press proceed to booking basket. Once they're in proceed to booking basket, you can see that they can write any information to the therapist, any special requests. For instance, I want this on the telephone or whatever, or any information that patient thinks that the therapist needs to know about them. They can then select the medium on here, so video, voice or text, and this can be adapted depending on how the therapy is going. Some people we find don't want to be seen or heard, therefore they will only engage with instant message, but we do encourage them to use the video option if they want to, or the telephone. So when they click confirm, the appointment is then provisionally booked, and what that then means is the therapist needs to go in and confirm the appointment. So you can see in the calendar here of the patient and they get an email notification saying it's provisionally booked, and the therapist will get an email notification to go and confirm that appointment. What that then means is the therapist, I'll show you now the therapist side, the therapist will have on their schedule that they've uploaded, will be able to see the appointment is now in orange as it's been booked. They will then be able to click on that appointment and then confirm or decline the patient. Now, once that patient books in with that therapist can go in and read information about that patient. There's information about where they've come from here, of the organisation they've come from, and they will also, if they've had initial assessment information done by the IAPT, by the NHS Trust or anywhere where they're referred, that therapist will be able to read that about the patient and make sure that they are the right match and the right fit for that person. The therapist will then also be able to allocate assessments to that patient. So for IAPT CBT and IAPT patients in general, they are required mandatory to fill in the anxiety PHQ-9, the anxiety GAD-7, depression PHQ-9, WSAS and IAPT phobia scales on every session. But we also have ADSM measures that they can fill in if the therapist deems that they need to fill them in for specific conditions. So if they want them to undertake a specific assessment, they would click on that assessment and then click Confirm Patient, which then goes green. That patient is then confirmed by the therapist for that appointment, and you can see that on the patient's side it goes green. Now, because that patient has asked because that therapist has asked the patient to undertake various assessments, they will then get a pop-up of what assessments they need to undertake, and that will keep popping up until they do those assessments. So they can either undertake those assessments via the pop-up, or they can go to the Take Assessments section and they will see which assessments they still need to undertake. So I have just completed an anxiety test, so that's why it's saying it's being completed, and I can view my results of that. But for instance, I haven't yet done the WSAS, so I'll need to complete that. So I press Begin, and then I can go through and answer that question. Ready for my appointment. So if I go back, just to show you what the anxiety assessment GAD-7 looks like. So this is where they undertake the various assessments that are needed, and they can do that via the platform. Now the idea is that the patient will undertake assessments through the platform before their appointment, so that the assessments don't have to be done during the session, which saves therapy time. So for instance, now that they can see the result of their anxiety, they can go through and do the other assessments that they need to do. I have already completed the social phobia assessment that the therapist has asked me to do, which is showing up. But if I hadn't, as you see, you would click undertake that assessment and go through that process to go through that assessment on the system, and then those results are then available to the patient and to the therapist to track the progress. And coming soon, they will also be able to see the graphs and make sure that they're going into recovery. So patients can go onto the top left-hand corner here and track what assessments they've done and the scores that they've had by clicking on the My Assessments section, where they can go through and look at how they've been doing, and also therapists on their side can track the patients and how they're doing with their assessments as well, and the therapist can look at the individual scores for those assessments. So we've got the ability for them they have to undertake the 4 mandatory assessments on every session, but also those anxiety disorder specific assessments depending on the condition the person has before each session. So the patient, we've spoken through now how the patient can book their appointment, how they can undertake assessments, and you can see that they can also do it from that screen there. But if they click on here and click Take Assessment, it takes them to the assessments that they need to undertake. And once they've done all their assessments that the therapist has asked them to do, they no longer get the pop-up that keeps coming up to ask them to do it. So on this screen here, as I said, they've also got the option to read about the platform, any help or support, some FAQs. They can look back at their previous appointments, and they can look at the appointments that they've had, and they can see their upcoming appointments. Now, because it's now 18:35, you can see that this appointment is ready to go. So long as the patient is logged into the system, if they're using a laptop, then through this web app here, you'll see the green button there for them to allow them to call the therapist and be connected. And this is the same if they're on their iPhone, our iPhone or Android app as well. From a therapist's perspective, I'm now going to show you how the appointment works. In the therapist's tab, if they click on the appointment and they click Start Appointment, the patient will get a pop-up notification, or they can click that button there, and then they can get connected into the call with the therapist. Now, it's a bit dark in here, but that's how they will get connected. I'll just turn off the button here. So this is what the therapist will see, and they will be able to undertake their appointment through the video. They can turn the video off if they want, both the patient and therapist, and can unmute and mute, and then they can speak to the patient and give them any useful assessments or links or homework through here that the patient can then look back on to make sure that they can go back and check out those links or go through the homework outside of an appointment. So it's quite useful for the patient to have that. So that's how the appointment is undertaken. And at the end of the appointment, the therapist will be able to then go in and create the notes about that patient based on the various IAPT necessity data, specific data, as well as obviously the clinical notes from that appointment. What happens at the end of the appointment is normally the patient would only book in the first appointment, and the therapist and the patient will have decided when they want future appointments. The therapist can then go in and create the future appointments for that patient and book them in, and then they'll get email reminders for those appointments for them to be able to be undertaken to help encourage engagement. And we find that we can try and increase our engagement rates and reduce our did not attend rates by having these email reminders and having the patient really interacting with the therapist and the patient actually going in and booking that first appointment. So this video is taken through the process of how a patient books an appointment with a therapist and can be matched, and how they undertake assessments, and how they then go and have the appointment through the system. Many thanks.